In this video, I'll share with you the 7 types of healthcare professionals that you want to know about so that you can maximize your brain health and use them when you need them. At the end, I'll share a resource to help you remember the details. At the hub of your healthcare, at least in the United States, is your primary care provider. This is often a medical doctor or an MD, but it can sometimes be someone in various other roles like nurse practitioners or a physician assistant. Although nowadays they're changing their name to a physician associate to reflect that they don't exactly assist, but they actually provide care with a team of providers. You go to your primary care doctor for checkups and most of the things that happen in everyday normal life. When you're concerned about your blood pressure, if you might have a cold or the flu, if you need vaccinations, or if you hurt yourself and you need some stitches. The primary care provider's role is to be a generalist. They're not supposed to have specific medical knowledge about every area of functioning, although some of them do have specific areas of knowledge where they specialize. And they're not supposed to know every medical question that you come in and ask. They are supposed to be good at fielding a lot of general concerns and referring to specialists as needed. They're also really good at following up with you to make sure that your healthcare concerns are addressed appropriately. A specific type of primary care provider is a geriatrician who specializes in aging. Just like people take their children to a pediatrician for help and understanding at the very earliest stages of life, we can also look for a provider who's experienced with aging issues in later stages of life, a geriatrician. There are many potential benefits to having a geriatrician on your team. They are highly familiar with changes that a person's body experiences as they age. They may schedule longer sessions to provide a more comprehensive care experience. They are often quite knowledgeable about changes associated with memory or other conditions that can impact cognitive functioning. They often counsel people about medications and how medications can impact us differently as we get older and which medications should be avoided or limited in their use for older adults. Research even suggests that input from a geriatrician in various circumstances, for example, if an older adult presents to have surgery, can lead to improved outcomes and reduced hospital stays. Another key player in the field of brain aging is a neurologist. A neurologist is a medical doctor who specializes in studying and treating disorders of the nervous system, including conditions that impact the brain. This can be things like Alzheimer's disease, Parkinson's disease, stroke or cerebrovascular disease, MS or multiple sclerosis, and ALS. A neurologist will often complete a comprehensive neurological workup, and they are the experts on understanding and interpreting structural and functional imaging of the brain, such as brain MRIs or PET scans. Older adults who are concerned about brain functioning are often directed toward this idea of obtaining brain imaging, which can be a wonderful addition to diagnostic clarification and adding a baseline for future comparison. A primary care provider can order brain imaging without you having to go see a neurologist, but I think this is a mistake for 2 reasons. One, you're missing out on the holistic nature of a comprehensive neurological exam, which can pick up more data that isn't available just on brain imaging. Secondly, when your primary care doctor orders brain imaging, the imaging data itself is fine, but the neurologist interpreting it is often a generalist. Now, generalists can be excellent and can have great understanding of change associated with normal and non-normal aging. However, I've often seen interpretations from generalists that describe changes as reflective of normal aging. And it's true, we all do experience some change related to age. However, I've often seen brain imaging then sent over to a specialist in geriatric neurology who looks at what the generalist said and says, yes, I see that. And also, using their specialized training and knowledge, they pick up on things that a generalist may have missed. Another type of professional involved in brain health is a psychiatrist. A psychiatrist is a medical doctor who has specialized training in the evaluation and treatment of mental, emotional, and addictive disorders. They often see people who are suffering from disorders like schizophrenia or other psychotic disorders, other mood or emotionally related disorders like depression or anxiety, or substance use. Psychiatrists will often do a comprehensive evaluation and can work with people in psychotherapy, but they often direct their knowledge toward the effective use of medications for these types of disorders. When a person is concerned about brain health, it is crucial to identify and treat emotional disorders. In some cases, this can cure the problem, such as the case of the pseudo-dementia of depression. But in other cases, people who have cognitive problems are experiencing additional distress from the emotional aspect of that disorder or other things in their life. And these conditions are treatable in a way that really improves quality of life. In a related vein, psychiatric mental health nurse practitioners, or PMHNPs, are another type of provider who works with brain health and aging well. They are licensed and board certified to work with people who have or are experiencing mental illness. Their level of training is not that of a medical doctor, but it requires a master's degree in nursing and specialized treatment in mental health. They also often use medications to help manage and treat psychiatric conditions. Because mental health challenges can cause or contribute to cognitive decline, and on the flip side, people who are experiencing cognitive problems can have emotional distress and other psychiatric symptoms, PMHNPs are a wonderful addition to a holistic team of healthcare. A clinical psychologist is a provider with a doctoral level of training, a PhD or a PsyD. They specialize in assessing, evaluating, and treating people who have mental, emotional, or behavioral disorders. This person is not a medical doctor, but is a highly trained professional who is often very familiar with the scientific research involved in diagnosing and treating disorders. They can't prescribe medication in most of the states in the US, but a handful of prescribers with specialized training do actually prescribe in some states. With regard to cognitive concerns, a psychologist or a neuropsychologist who has specialized training in neuropsychological assessment can be useful in understanding the function of your brain. This is useful not only in the diagnosis of what's causing the problem, but also to crucial information such as strengths that you could use to optimize quality of life and cognitive weaknesses where we can understand them and help you work around or adapt to problems. Other clinical psychologists who don't specialize in evaluation can do amazing work with clients who are experiencing some level of cognitive decline or with family systems. This can lead to feelings of support, coping strategies, access to resources, and other changes that contribute significantly to quality of life. In a related vein, a counselor or a mental health therapist is a provider generally with a master's degree who utilizes various therapy tools to help people with mental, emotional, and behavioral disorders. They aren't medical doctors or have a doctoral level of training, and they can't prescribe medication, but they can do wonderful work in providing supportive interventions, helping people with coping strategies, and helping people make changes to increase their quality of life if they might be struggling with this idea of a cognitive problem, memory issue, or some other geriatrically related concern. We've just covered 7 different types of professionals with the idea of giving you the vocabulary and understanding to be able to use the type of provider that would be best for your specific need. As promised, I'm offering a resource to help you to keep all of this information straight and to access the people you need. It's a downloadable document that puts everything in one place for you, and it's available in the links below. As always, it's a pleasure to see you in this video. The educator in me bows to the educator in you. And if you feel like someone else might benefit from this information, please feel free to share it with them. Thanks so much.